Hi, today we're going to talk about food intolerance, and we're going to talk about symptoms a lot of patients complain about, which is abdominal bloating. In medical term we call it IBS, or irritable bowel syndrome. So many patients come to us complaining of bloating, lot of gas, they eat a little bit and they feel that their stomach is full and they don't know why, although the amount of the food was kind of minimal. They attribute that sometimes to the nature of the food they eat. They try to restrict themselves, but they cannot be 100% sure about what to do about it. So they come to us asking for help, and luckily we have something to offer at this point for those people, and this is where food intolerance test comes handy. Let's talk for a minute or so about food intolerance. Food intolerance is a blood test where we take a sample from the patient. We measure the IgG, which is the antibody against certain food. We check for about 90 substances, and we will check by certain parameters the IgG in the blood, and we give it a score from 0 to 4. When a patient has a 4 for a substance, let's call it 4 against banana, this patient has a major intolerance to the food, and we'll have to restrict this food entirely for about 3 to 4 months until the body's immunity forget that this patient is allergic to certain food, or to this food in particular. So we look at the report. It summarizes to us how many substances. We try to restrict them. It depends on the score. For number 4, we restrict it for 3 to 4 months. Number 3, 2 to 3, 2 and 1 less than that, and 0, that means the patient has no food intolerance. By doing this, we can provide a lot of help for those patients who are having IBS.